Hello and good evening, ladies and gentlemen. EduGuy, a part of IndySmart Group and IIHM, presents how students and parents can beat the third corona wave. This is a special episode, and this evening, we will try to find answers if we've learned from our mistakes. COVID-19 has ravaged the world, and it has ravaged our country as well. The wave one came in, and then the second wave. We've learned from our mistakes or not is the question we're trying to find. My colleague, Jailam Banerjee, joins in from Calcutta.
Namaskar. Thank you, Abdullah. শুভ সন্ধ্যা। আজকের এই অনলাইন আলোচনাতে অংশ নেওয়ার জন্য এডুগায়ের পক্ষ থেকে সবাইকে স্বাগত জানাই। আমরা একটা অসময়ের মধ্যে দিয়ে চলেছি। কোনো কিছুই সঠিকভাবে ঠাহর করা যাচ্ছে না। ফার্স্ট ওয়েভ, সেকেন্ড ওয়েভ, থার্ড ওয়েভ এসব ঠিক কি? আগামী দিনে কি আরো ভয়ঙ্কর কিছু অপেক্ষা করছে আমাদের জন্য? কি কি উপায় বা পদ্ধতি আছে যা দিয়ে নিজেদের এবং বিশেষ করে শিশুদের এই কোভিডের হাত থেকে রক্ষা করা যায়? এরকম অনেক প্রশ্ন নিয়েই আমাদের আজকের সেশন, হাউ স্টুডেন্টস অ্যান্ড প্যারেন্টস ক্যান বিট থার্ড করোনা ওয়েভ। আর এই সব প্রশ্নের উত্তর নিয়েই আজ আমাদের মাঝে আছেন কিছু বিশিষ্ট চিকিৎসক। Our first speaker and expert for the evening is known as one of the finest pediatrician in the city of Joy. He's Dr. Arun Kumar Manglik. He's an MD Peds, DNB Peds, FIAP. He's a graduate from Medical College Kolkata. He's an MD Peds Maulana Azad Medical College Delhi. He's also a senior faculty and examiner for DNB Peds. He has been president to WBAP 2018, president WPNNF 2013 to 2014. He has been actively involved in academic activities with IAP, NNF, IMA, and other renowned organizations. He is also a national instructor for ALS, asthma, RTI, NLS, and several other courses. Good evening, Dr. Manglik, and a warm welcome to our session today.
Very good evening.
All right, that is Dr. Arun Manglik, who is one of the panelists. Moving over, ladies and gentlemen, the second panelist to do this discussion is none other than Dr. Shubhankar Home. He's a gold medalist in MS and did his fellowship at LV Prasad Eye Institute, Hyderabad. At present, the senior consultant is attached with BR Singh Hospital, Eastern Railway, Kolkata, as additional chief health director and head of the Department of Ophthalmology. He's also the guide and examiner for DNB in ophthalmology. He's also actively involved in free telemedicine platform during this COVID pandemic and in other social works like setting up of free oxygen parlor and isolation centers, doing relief work after the disastrous cyclones like Amphan and Yas in remote areas. This week, he has already visited twice the cyclone-affected interior regions of Namkhana and Sundarbans and has distributed dry fruits and other essential items to more than 1,500 people. We are honored to have Dr. Home with us in this discussion. Welcome.
Good evening.
Good evening. Our third guest and expert for the evening is an experienced and a very senior doctor who has a brilliant academic record. Dr. Gautam Ghosh is a gold medalist. He's an MD Pediatric, DCH, NMS Pediatrics, Fellow IAP 2007, Fellow Pediatric Pulmonology 2000, Fellow IMA Academy of Medical Specialties. He's in past National Chairperson, IAP Respiratory Chapter 2008 to 2010. He is also the senior DNB faculty for BR Singh Hospital for Medical Education and Research. He's an ex-associate professor for Institute of Child Health of Kolkata. As a consultant pediatrician, he is also involved with institutions like Ramakrishna Saroda Mission and Park Clinic in Kolkata. Good evening, Dr. Ghosh, and a warm welcome for today's session. It's such a pleasure to host you all in the same platform. Yes, over to you, Abdullah.
All right, ladies and gentlemen, the stage is set. And this evening, we will be asking some tough questions, if at all we are ready to battle the third COVID wave. Ladies and gentlemen, the panelists are there and the time to discuss begins. I would like to welcome the panelists and I would like to welcome everybody. And Dr. Home, who is the moderator of the day, will be taking this session forward. Over to you, Dr. Shubhankar Home.
Good evening, everyone. Before we start the session,
I think on behalf of IIHM, I would like to express my sincere gratitude to our two doyens in the field of pediatrics, Dr. Ghosh and Dr. Manglik, for sparing their valuable time for this webinar. Now, with the second wave showing a downtrend, we are slowly approaching towards the third wave. And this third wave is inevitable, and it's going to hit the children hard. In fact, children are already being infected everywhere, and especially, as you all know, in the district of Ahmednagar, already more than 9,800 children in the age group 1 to 18 have tested positive. And of that, interestingly, 95% were symptomless or asymptomatic. So as the virus mutates, the children and the young adults who are not vaccinated are exposed to this Wuhan virus. So our focus should be how to overcome this onslaught. Things that we get to know or want to know to protect our children from this pandemic so that they can remain safe and again go to schools as soon as possible. So I'd request everyone, all our viewers, to participate actively, ask questions, and clarify all your doubts from our two masters. And also we'll have some other panelists, pediatricians, who will be joining in this platform. So now I'd like to hand over the virtual podium to our masters, Dr. Ghosh and Dr. Mang. Over to you.
Thank you, Dr. Home. Thanks very much. And thanks IIHM for this platform and the opportunity. So we'll go straight to our question answer sessions. And we will be alternating or having some questions which I may pose to Dr. Ghosh and he may pose to me. And we'll go ahead with the program as we go ahead in any other session. So can we have the first slide, please? So Dr. Ghosh, meanwhile, while they are slide sharing, may I ask, what is corona actually? And how does it spread? The next one. The next one.
Yes. Yes.
The next slide. Yeah.
Yes. The two questions are, starts the ball rolling. And I first take it a point that we'll try to limit our discussion on basic level and not going into the deep medical genetics and physician level.
We will avoid medical jargon as much as possible.
As because I think almost there are 150 participants and counting, and most of their parents, of course, are very much educated. But we'll try to keep our discussions absolutely on day-to-day practice and answering FAQs. Corona is simply a common cold virus, just like Khasi said. Every child will have 6 to 8 cough and cold every year, at least. But if he had it during the last 2 years, he would be afraid and immediately run from pillar to post. Is it not corona? So coronavirus is a common cold virus. It has something called spike protein that has peculiar affinity. The only dangerous part is it can bring death within 2 weeks. It will immediately within 7 days invade the lungs, the blood vessels, the brain, the kidney, and all systems. It is just killing people like Spanish flu in 19th century. There are 4 variants: alpha, beta, gamma, and delta, and another 4 in pipeline. The delta is of Indian origin and the most disastrous at this point of time. Globally, there are 173 millions, and India 28 millions. These are the statistics of yesterday,
Next slide, please.
last week. Next slide.
Change the slide, please.
Yes, yes. Now, the next question, how does it transmit?
Yeah, how does it spread?
Any contact, since it is aerosol or air droplet. I'll not go into the what you call fight between is it a droplet, is it a aerosol, but it goes through the nose and mouth. Droplet, airborne, fomite, fecal oral to some extent, blood-borne from mother to child is also being reported, and animal to human. In fact, animal to human is probably if starting in Wuhan in China. How does it spread now? Person to person. So it is always from human to human. So if you talk loudly, cough, sneeze, even you shake hands, hug, put any file on your table, everything is transmitting the virus, which is dangerous. The most important point on this slide I want to mention is the dwell time. If two people who are unmasked, and one is a asymptomatic carrier and the other is myself, at least 15 to 20 minutes on an average. This is the dwell time. If we limit our contact less than 10 minutes, the chance of transmission is very much less. Next question.
So exactly, can we have the next slide? So this actually means that it transmits through various forms, and the main mode of transmission would be through the viruses coming out from your nose and mouth when you're breathing, when you're talking, when you're shouting, when you're singing, when you're coughing, when you're sneezing, because you're spreading the virus into the environment. So how is COVID different in children than from adults?
There are 4.7. Previous one. There are 4 points. Earlier one. No, earlier one. There.
After this. Yeah.
The first wave in 2020, children were very few, less than 1%, 2%, 3%. In second wave, it has increased. Fortunately, we have very few severe and critical cases. The admitted children with acute COVID are very less, and we are very happy. And I will finish this slide with one point. It is called multi-system inflammatory disease. COVID shayad ho gaya, it has 1 month back, asymptomatic, and the child gets a heart disease, a shock, a skin peeling, fever, a kidney disease, and what we call absolutely land up in ICUs. So this is a MISO called multi-system disease, and this is in children and adolescents. This is the only worst part the children have suffered from first wave. We are still waiting for its effect on the second wave. So this is the basic difference. Next question.
Basically in children, it's not all that severe. We have a lot of asymptomatic children, and the problem with that asymptomatic children is that they have the bug in their system, and once they have the bug in their system, they are unknowingly spreading it to the persons nearby. And the worst people who will be affected are the grandparents, because the grandparents hug the child, and the child, if asymptomatic, has the disease, will spread the virus to the grandparent, who is susceptible to have very severe disease and may be life-threatening for them also. So what they used to call them super spreaders. Unfortunately, whether we like it or not, our children happen to become super spreaders. So Dr. Ghosh, when would you suspect COVID, and how it is different from the standard common cold, which you, as you said very rightly, we have every 6 to 8 episodes a year in infants? Next slide, please.
This is $1 billion question. And we are still don't have straight away answers. From infection to disease, usually 5 days. So the first point is that the observation should be at least for the 4 or 5 days, but it will vary up to 2 weeks. RO is a term, is mathematical slope calculation. If one person infects more than 2 to 3, it is peak. If he infects less than 1, the peak is coming down as of now. The most important point, the clinical symptoms, they are asymptomatic. Most of the children of India and abroad probably have coronaviruses, but there was no symptom. If at all, they can have flu without fever, flu with fever, gastrointestinal diarrhea and vomiting, and severe group.
Next slide,
Most
please.
issue is loss of smell and unusual weakness. Loss of smell, a adolescent will tell, a 10-year-old will tell, and weakness is something which is very difficult to bring out in children than in adults. Next slide. Next, yes. The severe are 3 levels: lung disease, brain disease, and shock. I will not discuss, they're all in ICUs, but I will tell you this group are mostly in adults, not in children. So finally, 85-90% are mild, 10% may be severe, and 5%. So we're very happy as pediatricians. We have not written hardly ever any mortality not seen in children. What our physicians call it since a number of cases. So there is very little difference. How to suspect? Strong suspicion and history of contact. These are the only things that can help you, and be careful. At least if it continues for 5 days or more, go for a test. Next question.
Yeah. So can we have the next slide, please? What precautions should I take to prevent my child from getting infected?
There is no 100% precautions. Next slide. The answers are all depicted. You can look. All at this point of time, all caregiver, parents, grandparents try to get vaccinated. That's vaccine, vaccinate, vaccinate. That's the first precaution. And that's the easiest way. Isolate adults. Avoid mixing with unknown guests, whoever comes. Social activities to be online. 1.5 years, they're all on laptops. And there are some psychological issues we will come to last. Interacting with caregivers. So parents have enough time now working from home. They can give time, real time, to children. SMS, what has been told. Sanitize, mask, and social distancing. Remember, and I will last tell you, children are much more cooperative. Even a 1-year-old child will not allow you to move his or her mask. They come to my clinic, all clinic. Parents are breathless. But even a 1-year-old, 1.5-year-old child, more than 2 years is an excellent. They are putting a mask, colorful matching mask, matching with their shorts and trousers, and they will never allow the mask to come down. This is my experience, and so they are very cooperative. Next question, sir.
Next. So can we have the next slide? Now, if 2 members of my family are affected, okay, how do I go about it? Do I have to wear masks at home? And if so, which mask? And are there any drugs?
So now we have
Suppose there are
come.
2 members affected.
Okay. Now we have come to the stage when the devil has entered your room. Up till now, we're discussing how to prevent. Now, how to manage. Don't transfer them to grandparents who are safe. Keep positive parents. Even a newborn can be kept with a positive, normal mother. Nothing happens. They all pass out. Don't transfer them to the uncle's or aunt's house. That's unknown place. Observe for first 4 days. Do a throat swab on day 5. I told you day 5 is the cutoff. Especially in second wave, the things are getting early. Even by day 5, they are getting symptoms. So as of now, make a cutoff on day 5. This is for the second wave. We have seen in children. I repeat, in children, even RT-PCR is negative, but the symptoms are like COVID. Treat him as a COVID. RT-PCR will come positive later. And finally, SMS. Sanitize, mask, social distancing. And I will guarantee you, at least the science guarantees you, 90% plus will simply pass out even they are infected or the parents are infected. Next question.
So the crux from this slide would be very clear. The basic habit of many of our patients, we've seen it in our practice also regularly. Once a parent becomes COVID positive, suppose the husband gets COVID positive, they have a 3-year-old child, they may send the 3-year-old child to the in-laws house. Mama badi party de, mama ke ghar bhej diya. Now what actually happens if you send the child there? There is a grandparent over there. Now this child, the father has become positive now. The father had the infection 5 days prior to the onset of symptoms. This child was with the father during those 5 days. The child is very likely to have got the infection in his system. Child is asymptomatic. So the child is now going to spread and become another super spreader, which I was talking about. So that's the worst thing you could do. You send the child away to some other place. Keep the child with you. Well, mask, and as Dr. Ghosh very clearly pointed out, if there are 2 positives in the house, they can stay together. A breastfeeding mother can always continue to breastfeed the baby, irrespective of the child being at risk, because the benefits of breastfeeding far outweigh the risk the child will have. So we have to do the risk benefit analysis. Please, which mask would you choose?
Yes.
Any
This is
choice
again
of mask for a child?
use the same for children and adults. The issue is choose anything you have available. N95, a cloth, a surgical singlet, and so many without valves. Remember, the valves will allow the droplet to come out from infected patients. Mask is useful in 2 issues: stopping the droplets to get in and stopping the droplets to get out. So if you had a valve, so the person is infected, his infection goes out even he has a mask. So choose a mask which doesn't have a valve. And the most important I will want to mention is soft to wear and disposable. Now to bring an N95, which is almost 300 to 500 rupees some months back, is very difficult to dispose daily. Consider a parent who has to go daily out, at least he drives, and daily 500 rupees goes on a mask. But the issue is that then what exactly you can do, you can have 4 or 5 masks that we do as a pediatrician or physician. Monday, Friday, Tuesday, Saturday, right? So keep 4. Keep it in here and recycle it after 4 days, just in what you call sunlight sanitation. The question of double masking, where someone has asked, only in sure contact. There was in March, April, there are a lot of issues in the press. Use a mask in home, use a mask while sleeping, use double mask in home. Listen, don't worry in children. Don't need a double mask in children. They will be very uncomfortable. Only if you find there is a serious positive ICU patient followed up, he will have a double mask. Admitted in ICU, comes back home on a post-COVID syndrome, he may have a double mask, at least, or isolation. Others can have a single mask. Again, I tell you, dwell time is 15 minutes. What you do as a pediatrician or a physician, you don't interact more than 10-15 minutes to the child directly, or parents. We can ask for 5 minutes, ask him to wait, write down, ask him. Don't make a dwell time more, because dwell time is something that causes the infection. And don't remove mask. I have vaccinated, my area is fine, I will go to the mall or I will remove. Don't remove mask in a crowd. So these are the 4 issues for mask. Manglik.
So exactly, when you say dual time, it simply means the longer you stay with a person who is infected, whether he's symptomatic or not symptomatic, that's immaterial. If he is infective, he's continuously releasing the bugs into the environment, and if you are in contact with him, if you are close by, then obviously your exposure, the quantum of the bug which you're getting into your own system every minute increases. So if you're there for more than 15 minutes, the likelihood that you'll have you'll have an excess amount of the bug into you, which will cause disease, is the likelihood would increase. So we go over to the next part. Next slide, please. There are questions on sanitizers. which sanitizer should we use? Basically, you can
Next
use
slide.
any sanitizer. Next
Please
slide.
have the next slide. Yes.
This
This is for Manglik. Yes. Yes.
Yeah,
Proceed.
I'll carry on.
Yes.
Any sanitizer you can use, but it should be alcohol based and should have 70% alcohol in it. So that's the basic norm for the sanitizer. Now, the problem with the sanitizers are you repeatedly use them. If you're using them to scrub your hands maybe every 15 minutes or 20 minutes or so, you're liable to have some degree of skin damage. Your hands will become a bit rough. So you need to use moisturizers again to keep the hands, the skin soft. Otherwise, it's going to become hard. Now, masking at home, that is only required if you have a patient at home or a person who is positive at home, who may not be symptomatic but has been turned out to be positive. In those situations only, again, I would repeat, if you have two positives, if the mother is positive and the baby child is also positive, they can very well stay together. Okay, so that is one part. And wearing a mask at home is only required for, again, as Dr. Ghosh said, an ICU patient who has come back home, or a person who's been very sick and has come back home. On a follow-up, you can keep the mask at home for that patient, and that patient still stay subsequently in home isolation also, which would have been the regular advice given to the person at discharge from the hospital. Well, does the virus float indefinitely and may affect the child? Well, it doesn't float indefinitely. It may float for around, say, 24 hours, not more than that. It's not that once the virus has entered your room and you've not sanitized your place, it will stay there for years together. Not exactly that way. But it does stay on surfaces. As of now, the current knowledge, because we must realize, all of us, all our viewers must realize that this is a new disease. The disease is maybe just about 17, 16 months old. All of us are learning. We know this much, and we continue to play within that. We have two goalposts. This is one, this is the other. This much of knowledge we have. And I'm being very, very candid and honest about it. So what as of now, that the surfaces which they may have the virus, and the virus may stay on the surfaces for some days, sometimes even for 4, 5, 6 days. If you touch the surface, you catch the virus on your fingers. But the virus doesn't have the capacity to enter your system through your intact skin, because the skin is a super barrier. But if you have the habit of plucking your nose, putting your fingers in your eyes regularly, or nail biting, then what would happen? The virus which is there clinging onto your skin may enter into your system through the vulnerable points, and that is the eyes, nose, and mouth. So if you don't have that habit, or the best part is if you happen to touch a surface which is likely to be contaminated, then you jolly well sanitize or wash your hands with soap and water. That would be good enough. Next question was steam bath of airways versus gargle versus Nasayan and all that, or a special diet. Well, when we don't have any treatment, when we don't have any definite knowledge about the thing, lot of speculations come up. And that is actually exactly what has happened with this disease for the last 1 year. So we've had these immunoboosters, we've had this vitamin C, vitamin D, and we've had a host of drugs like hydroxyquinoline and ivermectin and all that. Many of the viewers would be might be laughing at some of our bosses sitting at the top, maybe ICMR and also the Ministry of Health, claiming that what the hell, yaar, aaj ek baat bolta hai, kal dusra baat bolta hai. Today you're saying that it is not transmissible, tomorrow you're saying it is transmissible, today you're saying isolation for 10 days, yesterday you were saying for 17 days. What is going on? Is this a joke? Well, let us be honest about it. As I said earlier, we know very little about it. We are learning every day. So why do we blame them? They are not gods basically sitting right on the top over there. They are taking decisions after coming to a consensus, sitting with a group of experts. I'm not one of them, but they are a group of experts who sit and decide on it, looking into the latest evidence which comes before them. And thereby those changes occur. Once a decision is made, and if it is found that something better can be done, then obviously newer guidelines come up. As regards steam bath of airways, at all it will help or not, but it will definitely help in getting over some other viruses also. You may not be able to get all the viruses totally, but the worst part is you may get the virus out from your upper respiratory tract, that's from the nose and maybe the sinuses. But if the virus has gone down a little bit, you can't get it out. Gargling, these are all good hygiene habits. Definitely they are good hygiene habits, but they are not assuring you that you can prevent your corona with them. That's not a guarantee for that, but there's no harm in doing it. Provided again a steam bath. Well, there are instances when people have got burnt getting steam baths. So be very careful when you're doing it. Particularly when your steam is coming, let it come from the front, not like this. Because if you do like this, there's strong possibility the water may sponge. You have a pail of water over here, or a container which contains boiling water, and then you want to take the steam, and some of the water splashes on your face and you badly burn. Something which you never like. Special diets, well, nothing special about the diet. You regularly standard diet which you have been taking, the balanced standard family diet, whichever. If you're a Bengali, you take non-veg. If you're a North Indian who doesn't take non-veg, we are very well comfortable with your veg food. That's perfectly fine. So the special diets have practically no meaning. Go ahead, next slide, please.
I have a point here. Excellent presentation before this. The issue is regarding steam bath. Excess steam bath for years together, at least months together, very hot steam. Someone prescribed a 70 degrees centigrade is minimum to kill the virus, but it will kill your mucosa. It will kill your normal defenses. There are some studies, I will not want to mention here, there are some studies which is still in Indore Medical College. The incidence of black fungus, what you call the incidence of mucormycosis, that has come up on post-corona, maybe, we still do not know, excess steam bath of the paranasal sinus and too much excess of zinc. But this is only a hypothesis. So someone took zinc tablets, not more than 50 milligram is needed. He's taking 200 milligram daily, years, at least a year and a half. So these are issues that may do more harm than good, and only time will tell. Are these triggers for the black fungus in post-COVID cases? Please, Manglik, it is your shares.
Yeah, thank you, Dr. Ghosh, and very rightly pointed out. If you're doing I mean, you should use whatever you are doing in moderation. If you're overdoing things, obviously you're asking for trouble.
Yes.
If you're taking at 70 degrees centigrade that steam, obviously you're damaging your own mucosa. And mind you, God has provided us huge amount of defenses. As I said, the skin is the best dressing which we have on our body. Inside our own openings, we have mucous membrane. We don't have skin because the skin cannot stay there. The mucous membrane is there, and the mucous membrane has to be taken care of. If I expose the mucous membrane to a lot of dangerous things, then obviously I'm going to suffer. Now, there were some certain of these drugs like hydroxyquinoline, ivermectin. There was a big blah blah of hydroxyquinoline about a year ago when Donald Trump accepted it and advertised it, sort of. Well, we had hydroxyquinoline in our regular recommendation from the ICMR also, but as of now, it's almost gone. Still, we don't know exactly whether it may still be useful. We still don't know, but it is not there in the as a regular basis or having of much use. Ivermectin, yes, again, it is still there. But what we know as of now, the science tells us the dose of ivermectin required to be an antiviral, proper antiviral agent is so high that we just never use that dose. Doxycycline, favipiravir, all these drugs are practically out of the gamble of the gamut of armamentarium right now. As of now, the drug which works for the first 5 days is paracetamol and paracetamol. The second drug which works is oxygen. And mind you, oxygen is a drug. The third drug which works is steroids. The fourth drug which works is anticoagulation. That's none of our business as far as non-medical people are concerned. But remember, one drug which works is paracetamol, and if required, you can have the oxygen at home. So as far as those drugs are concerned, as regards prophylactic hydroxyquinoline, ivermectin weekly, I don't think it is of much use. We've taken this in the first wave. I have personally also taken it, assuming that it might have worked, or it might work. I don't know whether it worked at all. Well, I have got my vaccine in January and February, the 2 doses, immediately when it was allowed as a healthcare worker. So I was lucky to get it then, and I've stopped taking all that. As regards zinc, up to 50 would probably be okay, because in general, we Indians have got a low zinc level in our system because our soil has got much low zinc. So our vegetables, etc., contain much less zinc than would be in certain other countries. So up to 50 would be fine, but again, it is again a double-edged weapon, because too much of it may predispose you to get mucormycosis or the black fungus, because it is well known that that fungus propagates in zinc. If zinc is there in the environment, it needs the zinc for its own benefit. So if you have too much of it, then obviously you're asking for trouble. Next slide, please. There is this is a 7-year-old who has fever for 5 days on paracetamol. Lovely. They've not given anything else. COVID report is awaited. The question is, should I go to the complex ground or the roof? Should I take the child to the roof? Well, ideally, yet again, there are another part to this question is whether the child has had contact with anybody with COVID or not. That's one. So if the family has got another patient who was COVID positive, then this child is likely to be COVID. Then obviously you keep the child isolated to prevent others from getting the disease. We must remember that. If the child goes to the roof and the child is otherwise physically fine, no harm. The child gets some fresh air. The child feels better. The sense of well-being comes in. But yes, the child makes others into risk. But yes, if you go to the roof and there's nobody else around in the roof, fine. Perfectly fine. If you go to the ground floor of the complex and there are few people, only 5 or 7 people around, and the first nearest person is more than about, say, 20 meters away, what's the harm? So you got to balance things. You got to understand that you can't have a very watertight compartment. Yes, in the first way we had those watertight compartments. Buildings, I mean, houses were blocked by roadblocks. Lanes were blocked. Well, that was the idea then, and that was very right. You got to contain the disease. You got to isolate the people so that they don't spread. Now we are already in the phase where there is community spread. There's already, it's almost, if I don't have it, my neighbor has it. If the neighbor doesn't have it, his neighbor has it. It's as close as that. So we are not able to contain it that way right now. Next slide, please. Yeah. Is it safe to have morning or evening walk? I think we have answered that question. If you have too many people having those walks, well, use masks. If you don't have, obviously, if you use masks, you are safer. I mean, you protect yourself and protect others also. If you have an RT-PCR positive, you isolate for 14 days. That's the standard norm. As of now, if the person has become afebrile for the last 3 days and 10 days from the onset of symptoms or a RT-PCR positive report, thereafter the home isolation goes away. Though there is a dispute on this, the central government says 10 days. Our state government guidelines still say 17 days. So that's okay. I mean, having an extra week in home isolation, apart from the psychological problems it creates, it doesn't have much of a problem overall. You can use safe homes definitely, but the problem, as very rightly pointed out here, these slides are prepared by my friend Dr. Ghosh, and I'm grateful to him to have prepared such wonderful slides. The problem comes with the co-residents. You have that huge complex, 500 families live in, and your flat is, you have one COVID positive. It used to so happen that in some communities it so happened that they locked your house from out, they locked their flat from outside. They won't allow you to move out for one moment also, and they would ring you and tell you, "Aapko khane mein kya khana? I will bring it to you. Aapko dal kiska lena hai? Aapko kya lena? I will bring everything. All your raw material, everything will provide." But this is too much of a thing. I mean, and these things happened, and finally the police had to come in, and all those things happened. Right now, things are much better off. So the problem is lack of cooperation, or maybe lack of knowledge, or lack of awareness among the other residents. Probably they don't know. They are not. They're scared for themselves. I don't blame them. Also, they're scared. But if they are told that the fact, what is exactly the fact, how much of risk do they harbor, then only then things can come in. what about sanitizing goods from coming from outside? You can use the hydrogen peroxide sprays, or you can just wash them with soap and water, or even in running water would be good enough. Okay, and obviously most of us usually wash our vegetables and fruits before we consume them. So this goes without saying. Next slide, please. Next slide. Oh, that's great. Should I get a flu vaccine? Well, there is a thought process going on that if I take the flu vaccine, I'll protect my child from corona. Well, not exactly. That's not true. This is not a COVID vaccine. But yes, flu kills huge number of adults and children and affects large number of patients every year. Before the flu season, you should take the vaccine because we've got enough of COVID load of patients. You don't want an extra load unnecessarily. You don't want that extra load. Absolutely, you don't want that load. So you should definitely get the flu vaccine once it is available. And as of now, the recommendation from our side is up to 5 years of age. But I would strongly suggest that everybody above the age of 6 months should take an annual flu shot for life. And this is the standard norm in the developed countries. Well, when will I get the COVID vaccine for my child? In between, I had a question I saw on the chat box. I'll just answer that straight away because I thought I'll take that question, was whether I need to take a repeat COVID test or an RT-PCR negative before I end my quarantine. You don't. The answer is a blunt no. You don't have to take a COVID repeat test before you end your quarantine. And here you can have a practical problem. If you are an office worker or if you are in a resident in a big complex, the complex people will say that unless you have a negative report, we won't let you out of your flat. Or your boss says, you get me a negative report, then only I'll allow you to join. Well, tell them very bluntly, as per Government of India guidelines, and they have very valid scientific reasons for that, this is not required. And I'll tell you the scientific reason. This is very simple. It's just a one-liner, that after 20 days also, you may get an RT-PCR positive. Now, that does not mean that you are infective. Why? Because the RT-PCR positive simply picks up the organism, which may be dead or living. And after 10 days, most of the time, the organisms are dead. So if they are dead and they are caught up in the report, that makes no sense. You are no longer infected because you are just harboring a dead organism. So you don't have to prove that you are RT-PCR negative, then only you can join work. If your boss is still very, very arrogant and says no, you tell him, give it to me in writing, then I'll give you the report. I'll give you the reply in writing. Well, when will I get the COVID vaccine for my child? It's anybody's guess, but I have a gut feeling that by the end of this year, we may have the COVID vaccine for children above 12. That's my gut feeling. Primarily because if you are able to vaccinate above 12 children, obviously there'll be around 10 crores in our country. Then in those situations, what happens that you are able to open up the schools for 8, 9, 10, 11, 12. So that's the advantage you have if you are able to vaccinate children above 10 years of age, above 12 years of age. So when will I get COVID affected child, RT-PCR negative now, you need not have to get that report. When can I get a COVID vaccine? Well, anybody. For the child, we still don't have the vaccine, but for adults, 3 months after you've recovered fully, you can get the COVID vaccine. Which one? Well, as of now in India, we have a choice of 3. We have the Covishield, we have the Covaxin, and we have the Sputnik. You take any one. You take any one, whichever is available to nearest. You don't try to pick and choose. Suppose you want that, I'll say I want to get the Sputnik and that will be available 20 days from now. That's nuisance. Get it as fast as possible. You got to protect yourself as early as possible. So you take the one which is easily available, rapidly available, and the next dose ideally should be still the same brand. But by any chance, if you're not getting that brand at all, suppose you took the Sputnik this time, and the next time, which is available, it should be around 21 to 28 days after the first was not available at that point of time because the small quantities had come up from Russia, then you can go for the other brand. Okay. Next, what do we have? Any further questions? Next slide, please. Is there an increase in COVID infection under 18 in the second wave? I think
Yes.
Dr. Ghosh answered that question very, very aptly. I just say one thing. In the first wave, what happened? That nobody was vaccinated. So everybody got the disease. And the adults or the elderlies above 60s suffered badly, and many of them succumbed. Now, many of the above 60s are now, most of them, at least I believe 30 to 40% of them are vaccinated. They also don't move out. So they are less affected now. So the proportion of children being affected now is a bit higher. But as Dr. Ghosh pointed out, most of the time the children don't have much of disease. They may not have any symptom at all. And if they have some symptom, they are usually mild. Only 1% of the children do get that MISC, which again is not the virus causing the disease. It is our system, the child system, the human system overreacting to the virus, and that occurs 4 to 6 weeks after the child had COVID. Okay, there's something to do with the recording. Now, we had this about the children, but more children have been affected. Probably the virus had mutated and could bypass the receptor. As we all know, whatever the science behind is, when the virus enters the system, it has to enter into our entire tissue, and for that they need a receptor which is called the AC receptor, which is deficient or less prevalent in children. That's why they don't enter into the system so easily, and that's why they just have a bit of a mild cold and it passes off. But with that mutant, maybe the virus is able to bypass that receptor and enter into that system. There has been a slightly more number of children affected by percentage wise, as you can see on the slide. But still, the picture for children is still better than that for young adults and elderlies. Next slide, please. Next slide, please.
Next slide.
Okay. Any difference in the symptoms in the first and the second wave? Well, the virus is mutating, is changing. Probably we are having the disease faster than earlier on, and the loss of smell or the loss of taste. Earlier on, we used to believe that it's an innocuous sign, it's an omen, which is bad, that it has told you that the child has got the disease, but overall the child would recover, and 100 times out of 100 it would recover. But as of now, whatever knowledge is, we have to be careful, because we can still have what we say acute COVID in children, which is the childhood involvement akin to adults, which happens in adults. In adults, what happens? It progresses to pneumonia. It affects your lungs, and your the lung has got two components: the air which goes in and the blood supply which takes into the lungs. So the blood supply is affected. Thrombosis occurs. That's why you use antibiotics. So you need to be on your guard, and particularly for older children, children above 10, 11, 12, because they behave similarly to like young adults. They can suffer with acute COVID also. If the child is still suffering from high fever for more than 4 or 5 days, be on your guard, get some tests done, consult your doctor. Maybe this child may be going into acute COVID, which happens in adults, and you may need to start off some steroids or some other drugs. What are the danger signs? Next slide, please.
Next
The
slide.
danger signs are very simple, like any other danger sign. High fever persisting for more than 5 days. Next slide, please. If breathing trouble, child having altered sensorium, that means the child getting drowsy, huge amount of cough which is not resolving, the child is having paracetamol and the fever is not coming down. I mean, fever not coming down, but what do we mean by that? By fever not coming down below 100 or below 101, it still stays above 101. Those are things. Then you have those inflammatory parameters, and the best one would be CRP, which we call the poor man's inflammatory parameter, because it comes relatively much cheaper. And if the CRP is, say, more than 60, well, you jolly well say that there is something seriously wrong. As for the chest CT, in children, we avoid getting CTs done because of the risk of exposures. But if you do a chest CT and if the scores are high, then you are not comfortable with it. Now, this last line which says the RT-PCR cycle less than 15, well, as of now, this is no longer considered as important. So it simply means that the bug has been grown into in the system within 15 cycles. If that figure had been, say, 30, that means you're far less, you're much on a safer zone. That used to be a thing thinking, but as of now, in fact, why I wonder why the labs continue to provide that data. They should simply say negative, positive. Forget the RT-PCR cycle figures. Next slide, please.
Next slide. I think it's almost through.
If one of family, should all children be screened? Earlier on, last year it was similar to that because we were trying to contain the disease. Since we already have community spread, what we do now, if you are symptomatic, we definitely screen. I mean, if the child has symptoms, you definitely get the test done after on day 3 or day 2. But you definitely be trying to isolate the parents. On which day of symptoms would you like to get your test done? Well, day 5 of contact, if you're not symptomatic, you may not do it at all. But if you have symptoms, day 2 to day 3 of symptoms, which one you need to go ahead with? Rapid antigen or RT-PCR? Obviously, an RT-PCR is a much better test, though it still has an efficiency of 70% only. That means you miss out on 30%. But if an RT-PCR is positive, you are positive. As far as the rapid antigen test is concerned, it has a lesser sensitivity. So as a result of that, if an rapid antigen is positive, you don't have to repeat the RT-PCR because you're positive for sure. But if the rapid antigen is negative, and you have symptoms which are similar to likely to be COVID and have had a contact with the person, in that situation, it's better to repeat and do an RT-PCR to make sure that the child is suffering from COVID or not. Okay, so a negative rapid antigen test has less value. A positive one is definitely much more value. Next slide, please. Child with mild symptoms, positive COVID. Well, yes, which is exactly the vast majority of our children. Home isolation, how? With parents or grandparents? Never with the grandparents. Never with the grandparents. With the parents, and I would be happy if the parents have also been vaccinated. Or if the parent had COVID earlier, maybe 3 to 4 months earlier, probably they are protected. So let them stay with the parents, not the grandparents. Treatment, obviously, as I told you, treatment is very minimal. You can give your vitamin C, vitamin D, vitamin and zinc. I sometimes feel that giving these means you're going down on a vitamin M. Your money is going away down the drain, maybe. Anyway. A good diet. You can use antibiotics if you're suspecting something beyond COVID. It may be, I mean, as of now, we must realize that we as physicians have to consider that all other diseases which were there when COVID had set in still exist. Every fever is not COVID as of now. So we have to still consider this child may be having simply common cold, as somebody asked. And Dr. Ghosh replied very, very aptly that how to differentiate, we just can't. It may be a simple common cold, a bacterial infection. If it's a bacterial infection, obviously you need some antibiotics, and azithromycin would be a good one. But a blanket use of azithromycin in every patient who's suffering from fever or has a bit of a sore throat is out of the way. Next, please. Can the child be a super spreader? Even yes, we answered that question very, very clearly. Definitely, they can be super spreaders. How caregivers may prevent themselves while caring children? Obviously, mask, mask, mask. If you mask yourself, if you use masks at home when you are there, obviously you can't use PPs, but masking and maintaining as much of, if you're a caregiver to a child, obviously the child will be on your lap, it's a small infant, or would try to go onto your shoulder if the child is say maybe a year and a half old. These things will happen, but try to be as much as possible a bit aloof. But yes, you must wear mask, and the child is above 2 years of age, we definitely say you can make the child wear a mask as well. Next, please. Mother positive COVID positive newborn, either not tested or negative. The newborn can stay with the mother, at least for the breastfeeding part. If you have another lady who can be helping out and she is known negative, then she can care for the child while the breastfeeding is not being done. For feeding part, the baby comes to the mother wears a mask, washes her hands or sanitizes them thoroughly and feeds. breastfeeding is the norm. Clear? Mother positive, newborn positive, both are positive. Ash karo yaar, khush raho. Fine. Both will recover. 99 times out of 100 or 999 times out of 100. But to prevent others from getting it, obviously, stay in isolation and definitely masking. Well, here, since both are positive, if the mother is in a room, she may not wear a mask while feeding. But if there's somebody coming into that room, obviously it's better off using the mask. The biggest problem of advising people not to wear a mask, as I just now said, the biggest problem is they get the idea, nahi penna hai to, theek hai, even if that lady comes, I don't wear it. That idea should not go. So at the end of the day, mask, mask, mask. I mean, we used to say SMS, distancing, sanitizing, and masking, and we add another V, SMSV, vaccinate. So these are the four things, the four pillars, or there would be another V to that, and that would be ventilation. If you're in a place which is well ventilated, it's not a small office which just has got no windows and has an AC on, you're in trouble if you have a COVID person coming to meet you and the person stays with you for more than say 15 minutes. Then you're in trouble. But if your own office has got, it's an open thing like it used to be maybe 30 years ago with fewer ACs, the windows used to be there, you have fans only, then you're less liable because the quantum of the organism which is spread by the person who's spreading or exhaling the virus would be diluted by those windows. In an enclosed space, you are much in danger. That is the reason why malls are closed. Your these banquet halls are closed. Your cinema houses are closed.
Theaters.
Okay, your theaters are closed. So that is the reason why this is happening. So child stays in NICU. Yeah, next please.
Next one.
Can we nebulize a child with COVID? Yes, you can, but it definitely has a lot of aerosol production. But if you have, you can nebulize in a separate room, and ideally you avoid and use inhalers. You got to teach them. In fact, overall inhalers are better than nebulization. Inhale budesonide as a prophylaxis. As a prophylaxis, I don't know whether it's at all useful, but definitely part of treatment because it's inhaled steroid which works very, very well. And obviously, it is something which cannot be given an offhand advice to non-medicals, and you start getting inhaled budesonide at home for just for the heck of it. Please don't. Can we use oral steroid at home? Yes, if a doctor advises you. If you're clinically not that bad, you're quite fit, you can use if you feel that the indications are there. Next slide, please. Vaccination below 18 years. I think we've taken that question. Acha, these regarding these things. BCG, MMR, an additional BCG and an additional MMR at this age is of no value. But many of our children, most of our population, I mean, I'm talking of people who are around 30, 35 now, have got their BCGs when they were young, have got their MMRs when they were young. Probably, again I repeat, in inverted commas, probably that is helping out us because we have got less of infection compared to what the West has suffered. They didn't have the BCG. They had the MMR. They didn't have the BCG. Next, please.
I think it's end of it almost.
Okay. Now, I think we should, this is more of a scientific thing.
Yes.
This is more for the doctors to realize. And for the parents, I just have one message over here. If the child had COVID, even if it was asymptomatic, your parents had COVID, the child was not tested, child didn't have any symptoms. 2 months down the line or 6 weeks or 4 weeks down the line, if the child gets fever, tell your doctor that my family so-and-so had COVID 1 month back. Because then that will make him on his guard. We need to have a high index of suspicion. If you have that high index of suspicion, because this can be life-threatening. About 1 to 2% of children with this condition die out. So this happens in 1 in 100 of COVID infected children, and out of those 1 in 100 of these children die. So that way you can assume that 1 in 10,000 of children die because of something which we could have, a death which we could have prevented had we recognized the condition early and managed it proper. Of course, death is in his hands. If he says, "Kal tere ko marna hai," then I won't get up tomorrow morning. It's as simple as that. So these are the drugs. I think we need not go into that, IVIG and steroids and all. Next, please. Do we have vaccines? I think we've talked about the vaccines. We probably will have, I mean, if you want, we can discuss about this, but we have got 3 vaccines as of now: Covishield, Covaxin, and the Sputnik. Probably Pfizer and Moderna will also be there. I would repeat, please take the vaccine as early as possible, whichever is available to you. If you are not vaccinated today, get it done tomorrow. Don't think, अरे Pfizer वाला आएगा, वो बोला अमेरिका में वो अच्छा है, मेरा को
Don't do it.
मिला है, I'll
Don't
take.
do it.
That will come 2 months down the line. By the time you are probably in the grave. You don't want that. Next, please. Third wave, we don't know. Well, this honestly, we just don't know.
Last slide, yes.
Speculation is there. We may have a third wave, may not. There is a lot of scientific data behind which suggests we may not have a third wave at all, because of the simple thing. In the first wave, we assume that 15% of our population got infected. The second wave, around 30% more or 40% more. At the same time, we must remember that we have vaccinated 170 million out of 1.4 billion in our population. We've already vaccinated 170 million who got at least 1 dose of the vaccine. And this is counting. Every day we are vaccinating around 30 lakhs. That's around 3 million. So that's a huge number. So with these figures, we must remember that we may be able to vaccinate a large number of people by the end of this year. So we may not have the third wave, but that does not mean that we would lower our guard. Mask lagao, mask lagao, mask lagao. Don't go to crowded places. Avoid AC rooms, small cubicles. Okay? Don't, and avoid meeting too many people at the same time. So that would be all from my side, I think. Next, please.
Yes.
Okay, how to post-COVID management. Yes, this is something very important. Thankfully, in children, we don't have much of this problem, but yes, they have certain problems, that is excess of asthenia, as they say, a lot of weakness. I mean, the child feels so not feeling like getting up. Well, that passes off with time. You don't have an extra diet or an extra drink which you can give, and you may just make the child obese if you're giving too much of those extra high calorie drinks. Screen time is a big problem, because now you're using that laptop for studying, you're using a mobile for all lot of things. So that thing which definitely eye problems will occur, and we'll have a lot more myopias developing. Lot more myopias because of, and I'm sure Dr. Home will elaborate on this in a much bigger way. And post-COVID depression is particularly in children is more because the issue is not being able to meet friends, or if they lost some grandparent or a parent, that's a big psychological issue. And the third part is children who are in the age group of 16, 17, 18, who are going to class 12. They had thought, I'll study this, I'll study that. They don't know. They might have been a brilliant student, but they're not able to have the opportunity to display skills. No exams are held.
Finance loss.
So they are suffering because of that psychological issues. Next slide, please. Do you have any more questions, or we can take questions from the floor? I think we will be taking questions from the floor.
Dr. Chong.
Okay. Thank you, Dr. Ghosh and Dr. Manglik. I think it was an excellent presentation. I think I'd like to thank the IndiSmart Group and IIHM for giving us this platform, and especially we got the two doyens. I think most of the questions have been covered. In fact, I was going through the questions which are being put up through this session, and I think 90% or more have been covered brilliantly. But still, I think we'll take few of the questions after a small break. And just regarding the last point about the ocular problem, I think it is true that we'll be finding more myopias, and the most important what we are still finding nowadays, and will be much more in the days ahead, is the dry eyes. Because of the constant use of computers, mobiles, I think the students and the younger generation, they are facing a lot of problems, the redness of the eyes, irritation, uneasiness, headache, and these are only due to the dry eyes. And what preventive aspect, what I would suggest is just go on blinking. Do not stop blinking. These are computer vision syndromes. Do not stop blinking. Always take rest after 10 or 15 minutes. There is always a 20-20 rule that after 20 minutes, you take a rest of 10 seconds or close your eyes, wash your eyes regularly. And if needed, if it is very severe, then you have to use lubricating drops. But that are all technical things. I think we should take precautions, try to avoid as much as possible the computers and laptops. So I think I'll hand over the mic to Abdullah. Before we'll take a short break of 2 to 3 minutes. And after that, we'll come with a few questions and answers of the viewers. Okay, Abdullah, please.
Absolutely. Thank you so much, ladies and gentlemen, for all the people who've just joined in to our Facebook page feed, to 3.6 million people who are watching this.
Oh, great.
You were in conversation with Dr. Arun Kumar Manglik, Dr. Gautam Ghosh, and Dr. Shubhankar Home on talking about how students and parents can beat the third corona wave. Well, this is a special episode today, and now we will be opening a question and answer session after the break, where we'll be taking up your questions and trying to answer all the questions that have come to us. The chat box is open to all the people who are currently with us here. Please put on your questions in the chat box. We'll take a quick 4-minute break. We'll be right back to answer your questions, discuss about the black fungus, the yellow and the white fungus that has come in, and how to be prepared to handle the third wave that's coming. Don't go away. We'll be right back after 4 minutes.
Hi guys, what career suits you best? Well, EduGuide knows it better than anyone else, because when you take the ECPT, EduGuide gives you a range of courses and a range of career, over 2,000 career to choose from, whether it is from aircraft engineering to cyber security to data science to artificial intelligence and to digital marketing, whether it's something to do with basic science or actuarial science or natural science or mathematics, or it's something to do with our physics or chemistry. If you come and take the ECPT, the advantage is that not only you get the traditional courses, but you get all these new age courses, which actually gives you a new age career. So we at EduGuide in the ECPT have got more than 2,000 careers inventory for you. Can you imagine? 2,000 career, and most of these careers are all new careers. So I suggest strongly that you take the ECPT and choose a course from the 3 top recommendation from the ECPT, which will actually change your career. And not only that, these are the new age courses made absolutely suited for you through the IBM's artificial intelligence mechanism.
One of the interesting feature is the aspiring students who already appeared at high secondary examinations or will be appearing at high secondary examinations, they will be given a chance to choose their career through a psychometric test which is based on artificial intelligence. And this will definitely give the students a proper guidance in choosing their career from different courses.
Now, deciding on a career is a complex task which requires you to take different points of view into consideration, do a lot of analysis, and be aware of all the different fields out there. Personally, I've done my master's and bachelor's, and during this lockdown phase, I was doing an analysis of my strengths and interests to come up with a specific career plan.
Children, they finish their class 12 and they go in for college. Children are at crossroads, for they do not know the career or the subjects they should take up for their higher studies. Well, the answer is simple yet not so simple. They should do something which suits their personality, aptitude and interest. So EduGuide has come up with this kind of a test. It has been conceptualized by Dr. Bose. It will surely be of immense help to them.
EduGuide is a career predictive tool, one of its kind. It's a very novel idea that has been conceptualized by the CEO and founder of EduGuide, Dr. Subhanu Bose.
EduGuide has come up with ECPT, which is actually a scientific tool which uses artificial intelligence and machine learning, is a state-of-the-art development by the scientists from IBM and Edugai, which will actually predict which career is best suited.
So think of a situation. I rewind myself back many years, some 30-40 years back, when I was looking for a career, and there's so many questions that were in my mind, and I was really looking forward to talking to somebody who has the worldview, who can guide me, most importantly understand me and recommend to me what probably is good for me going forward in future. So there's understanding involved, understanding me, giving the right recommendations, having known what is happening in the market and what's going to happen in future.
Don't waste any more time because you owe it to yourself. Go and take the Edugai Career Predictive Tool and be successful in your life, because the career which you will choose from the test will definitely be the best career for you. Go for the test today.
Good evening, everyone. We are again back after a short break.
All right, welcome back. Welcome back, ladies and gentlemen, and we are certain that our audience is able to take away a lot of very pertinent information this evening by our esteemed panel of medical experts. We would like to talk today a little about ECPT, the Edugai Career Predictive Test, which is a state-of-the-art career counseling service which is powered by artificial intelligence and deep learning. This new tool is a unique software product and one of the most advanced career counseling services, which is provided by Edugai and IBM jointly. ECPT is a 120-minute AI-powered career test that has 3 segments in the module, highlighting IBM's 3A career recommendation framework. This is based on the foundation of 3 factors, which is attitude, aptitude, and aspiration. Depending upon the scores one gets from the aptitude and attitude sections and interest shown, this AI algorithm discusses the user's true potential, ability, and in the end provides with 3 best fit career recommendations. The scores are represented with a spider or a web chart, a 2-dimensional chart that plots a series of values over multiple quantitative variables expressing one's strengths and weaknesses. We would also like to tell you a little bit about the launch of our ECPT in Hindi very recently. We would like to remind you that we have got some fabulous products which has been launched through ECPT very recently. One, of course, happens to be a free test of 15 minutes. We shall be giving you an overview, just like a mock test, giving you a lot of career choices, the top 10 ones. We also have an ECPT paid test of about 999, which is a promotional offer, giving you the top 3 career choices. Apart from that, we also have a career counseling service at 799, and a test with a career counseling service also, which parents can go ahead and of course subscribe for. These are the services by ECPT. And now we move forward to this very important and special evening. And for that, I would like to call upon again my colleague, Mr. Abdullah Ahmed. Over to you, Abdullah.
All right. Thank you so much, Sanchari Chaudhary, and welcome back to all the people who just joined in. Ladies and gentlemen, you watching this special episode by Edugai, which is a part of IndySmart Group and IIHM, and it presents how students and parents can beat the 3rd corona wave. Well, we've seen the PPT, we have listened to the doctors, and the doctors in the panel discussion is back again to answer all your queries. We've noted all your questions, and Dr. Shubhankar Home, who is the moderator of the day, will be taking forward the Q&A session. Over to you, Dr. Home.
Thank you, Abdullah. So we are back after a small break, and before we take the questions, we are glad to announce that one of our senior pediatricians from London, Dr. Arvind Gupta, is with us from the very beginning, and I just want to connect to him for a couple of his thinking about the Indian third wave or what is the situation is UK like. Dr. Arvind Gupta is a senior pediatrician at the Queen Elizabeth Hospital, Woolwich, London. So, Dr. Gupta, are you there? Arvind? Hello? Hello?
Dr. Home, we do not find Dr. Arvind by that
Gupta.
name as of now.
Okay. So, I think is there then, okay, we'll take the questions now. I think most of the questions have been answered. One question is there about the cloth mask. It is also quite common that most of the people are using cloth mask, and we recommend 3-layered mask, isn't it? So what are the cloth masks that are available in the market? Are they 3-layered, and should the people or the child use?
Dr. Manglik, you're muted.
Yeah, muted. Fine, thank you.
We've got Dr.
Well, the
Arvind
cloth-
as well. We can locate him.
Okay. After
that's
that we'll take. Yeah.
Okay.
Can I talk or should we?
Yeah. Dr. Manglik, carry on. Please.
Yes.
Regarding this cloth mask thing is, unfortunately, the cloth mask will not protect you from COVID at all. It will not hold back the viruses. It may hold back some big particles, but yes, as Dr. Om just pointed out, if it's a multi-layered mask, it definitely helps in a very big way. At least 2 or preferably 3 layers, even if they are of fine cloth, those help, rather than having a single layered mask, which is of no use. Okay. So, but I repeat, the cloth mask will not keep out the viruses. Will definitely keep out a lot of other things, and those are important because we don't want more patients suffering from other diseases as well. Our hands are full with COVID, so we don't want other diseases. So, overall, the mask will definitely help. Even the cloth mask will help, but it won't hold back your viruses.
Yeah, perfect.
Good evening,
So-
Dr. Gupta.
Yeah, good evening, Dr. Gupta.
Good afternoon from London. Thank you,
Yes,
Doctor,
and after.
for having me. And I was listening to Dr. Ghosh's and Dr. Manglik's fascinating talk. I was well informed as well in several matters. I mean, talking in general about the scenario in UK, and I will talk briefly about an interesting article which I read in the Times of India this morning. I mean, overall, the message is the same: hands, face, and space. And I mean, there is no getting away from these 3 basic things. I mean, washing your hands, putting a mask, putting on social distancing. If you have, I mean, just to add, I mean, because you were also discussing the pediatric perspective, I'm sure Dr. Manglik and Dr. Ghosh would have covered it in their talk. I mean, the children below 1 are the ones who are especially at risk. Children who have asthma or, well, diabetes is a common problem here, and sometimes in less than 1, with children with heart conditions, children who have who are on immunosuppressants, cardiac conditions. So these are the children whom a special watch should be kept by the parents. And there's also a recommendation, I think, from the CDC that children above 2 years of age, they should wear masks. There's also a lot of interest actually on indoor ventilation and things like that, which I think Dr. Manglik had covered. I mean, I was reading about this article in the Times this morning, and it said that in India, from only 2 to 5% of children, by and large, have been affected in the first and second wave. And considering that 40% of the population is between 0 to 18, it's a very tiny number, isn't it? And the thing is, by and large, children, they get very, very mild illness. And even in our hospital, I think the youngest one we came across was a 3-month-old baby. Of course, we were forced to carry out a test on this baby because all the parents had also been admitted with severe COVID. And this child was actually very well. So, and as you know, the multi-system inflammatory syndrome, they were first reported in the UK from the Evelina, and 8 of our patients in the hospital, actually, they were sent to the Guy's and St. Thomas's Hospital. So, I mean, in short, children, by and large, they get very mild disease. So it's not to panic in those situations. The transmissibility from children, though they are asymptomatic, is also a big question. How transmissible diseases are from children. Some people think it's not, they don't spread that much around. But again, it's a question thrown to debate. So I just wanted to add these few things as regards the management. Well, I think in India, there are different and varying protocols to manage COVID. I will not go into that, which Dr. Ghosh and Dr. Manglik has covered well. That's it from me.
One point, sorry, Dr. Arvind. What is your guideline about the possible third wave in UK, and if at all it comes in India? Because you are more experienced in having the third wave. Is it really in UK now?
Well, there is talk about the third wave, but I think it is still, Dr. Ghosh, in a very germinating stage. That's what I would say. Because it seems that with our effective vaccination strategy, we seem to have broken that link between infection and basically the disease. That's what we think. But yes, I mean, some of the pundits are still speculating that there will be a third wave, which we seem to be having sort of. Like, the Indian variant has now come to the UK, and it is a predominant variant now in the United Kingdom. But I think when the second wave struck, we had about 60,000 cases per day. But now we are only having about 5,000, which is still a jump, because we were having about 1,500, 1,600. We had gone down to that level. So it is still a jump, but we are not predicting. The pundits are still not predicting that there'll be a florid third wave, really.
Thank you.
All right.
That's primarily
Thank you, Dr.
That's primarily because of your successful vaccination program.
Perfect.
Yes. So again, I must reinforce that message that parents, they must get vaccinated.
Right.
That's the most important thing.
And I think after plus 12, if the vaccination comes, I think that should get a priority. And now
we have just been sanctioned for the 12 and 15-year-old just recently, actually.
Yeah, perfect.
All right, I'll leave you. Thanks, Dr. Home, and thanks, Dr. Manglik and Dr. Ghosh. Thank you very much.
Thank you, Arvind. Bye-bye. Yeah, there is another question, or there is a concern about the antibody testing. Will you highlight whether to go about it? Antibody.
Yes, the answer is straightforward. I had a last slide. So don't make it jinx. If there is infection, basically this can be understood by all people who are listening. Virus goes inside the nose or the airway. That is infection. But he have no disease. Then the disease comes. And when the disease comes, body produces immunity. And antibody is an expression of immunity. There are two groups of antibodies. Early presentation, we call them Ig, immunoglobulin M, and late. There is another group that's a T cell mediated or memory cells. The issue is, should I do an antibody test to find out my vaccination is perfect? Number one. Answer is no. Even if you do a good vaccination, antibody chance may be high, but it will take some time, maybe 4 weeks. And all the most important, every person is different. Dr. Home may have a very high antibody with Covishield. I may not have it, though we are absolutely same age group. So doing an antibody to find out my vaccination is working or not is not needed. You just complete your vaccination. Number two, when I come out of COVID infection, COVID disease, should I get an antibody? I have an RT-PCR positive, throat swab positive, throat swab negative, and my antibody is also positive. I'm happy. You don't need to do it again. If a throat swab is positive, RT-PCR as we call, and after 10 days or 14 days or 17 days, whatever the period is, you are clinically fine. You don't need to do an RT-PCR or virus detection by antigen. We don't need to do an antibody.
Perfect.
The only place where you need to do an antibody is in children.
Yeah.
If you get multi-system inflammatory disease after 6 weeks, you might don't have an RT-PCR because that has thrown away the antibody, the IgG, the humoral antibody. And finally, if the antibody of the T cell or thymic cell, there are a lot of their neutralizing antibody, they will make the long-term cover or long-term protection. So the finding out the T cell or thymus-induced antibody or memory-induced antibody is a job of the scientists. If they find this vaccine gets a good memory cell, then that vaccine gets a good efficacy. That is a long term. So antibody detection only for children if you suspect MISC. You don't need to do a routine antibody to check your vaccine, and you don't need to do a routine antibody test to say you are out of it.
Yeah. So unnecessary money.
Just add one line to it, and just to corroborate what he said. Please don't try to get your antibody levels done to find out whether you are protected or not. You're making a fool of yourself and you're wasting your money.
Yeah, money.
If you got too much of money, please donate to people who are in need of it. Please don't get the test done.
Well, there are a lot of questions about this fungus, and we have already dealt with it. This black, white, yellow fungus. There are a lot of questions. I think our experts have already dealt with it. Basically, they have said try to avoid. Yeah. Yeah, and the only thing I can add is that these are the diabetics are more susceptible, and those who are less immunity, so take more precaution. And rest, I think our experts have already dealt with it.
The fungus is there in our environment everywhere.
Yeah,
it's there everywhere, but we don't get it because we are immunocompetent, as we say. If you are immunocompromised by any way, and that's one is diabetes, as he said, if you're suffering from cancer, if you have some other illness, or you're on long-term steroids, or have got bad comorbidities, then fungus may catch you.
I had only one point to add with all Dr. Home and Dr. Manglik. We are almost 35, 40 years, isn't it, Dr. Home and Manglik, since our house staff days. And there are our teachers who are living still alive with 50 years. How many cases of black fungus have we seen in India? Forget about the world. In India, since 1970 to 2010. And how many cases are we seeing last couple of weeks?
Yeah,
and only in second wave. Only in the second wave.
Yeah, we have. In fact, I have seen more than 5 cases. Yeah.
It is your department and the ENT department.
Yes.
And there is probably something, for example, I don't know. That's why I tell there are some issues. Using a mask, an N95 mask for months together, the entire lower inside is blackened, moisture, you can't help it. It's 500 rupees and he's not earning, he has to use it for a bus travel. And the the black or the white fungus was not in the first wave.
Yeah, correct.
I only say we don't know still why this is coming. It is, I personally feel
there may be many causes here.
Unfortunate to blame only corona. Yes, it's a trigger. I just want to end here that during our pathology days, can we remember, have you ever read rickettsia? In our pathology days, हम लोग कभी typhus पढ़ा ही नहीं. It never comes in examination. And in 2004-05 to up till now, we are getting each and every case.
Yeah.
So as the typhus or rickettsia is coming up, right? Probably.
Next question is, while a COVID positive mother feeding her baby, will the virus pass to the baby?
Manglik.
No, not through the milk. Yeah. Definitely not through the milk. It can pass through your breath. So that's why you wear a mask, but not through the milk. Please, not through the milk.
Now, this is from my side that before I think we end, or we have another 5 or 10 minutes, I suppose. What will be your message or the precautions by the parents and the students. I think after a few months, the schools will reopen. So one thing is that mask. Avoid air condition. I think many schools have air conditioned rooms. I think they will have to keep it well ventilated rooms and other things. And still, if the third wave comes, we do not want it to come. But if at all it comes, or to prevent it, what should we do? Just few lines from both of you to the students and parents.
Should I? The answer would be, we would try to vaccinate our children before we open the schools. That's number one. Number two, even after you have taken the vaccination, the teachers and the other staff in the school should also be properly vaccinated. Number two, lesser number of students in your class. But then you will be able to space out the seats. Otherwise, in a crowded classroom, you are asking for trouble. So lesser number of students, make them wear the mask in the school at all times, and they must be changing the mask. Otherwise, you're using the same mask day in and day out, you are again in trouble. So these are the few things which will help you to prevent getting infected even if the third wave comes. And obviously, if the third wave comes, probably we may have again back to square one. That is, schools will close down once again. Might close down again for a few weeks or a few months if the third wave comes. Because we had, if I remember, at the end, sometime in January, February, some schools had opened up.
Yeah.
When we were on the down decline, the first wave down, we thought that we've beaten Corona, it's all over. We never thought that we'll have a second wave. And in fact, many of us did. So we still don't know. And the best way to protect is again the same thing. There are some questions in the chat box. One is here right in front of me, which says, I have been treated, I have become fine, but still I remain positive. You need not test again. Please don't do it. Please don't do it. There's a question: is high sugar level is the high sugar level by some the side effect of COVID medicines? No, COVID itself can open up your diabetes if you are prone to it. Okay. This is another thing.
I think another question is there, is high sugar level side effect of COVID medicines?
No, not medicines.
Yeah, it is due to.
It can be the COVID, the virus itself may be hyperglycemic.
Not likely.
But it is not because of the medicines. Yes, one medicine can cause it, and that's steroids.
Steroid.
But that is a temporary issue, transient issue. You're not giving steroids for weeks or months together. You're giving it for maybe 10 days or so. So that at that phase, you can get a bit of a high blood sugar. But once you stop the steroids, things will come down. There's one question: if somebody has allergy by medicine, can you take the vaccine? Please, you can take the vaccine. The only thing I'd suggest, please take the vaccine in a hospital. Don't take it in a housing complex, because you're not having those camps, people coming up and vaccinating you. Take it, go to the hospital, because if you have any allergy, wait there for 30 minutes at least. Because if you have any problem, that can be tackled very, very easily. Okay.
So I think most of the questions have been covered. I think, is sodium hypochlorite a good disinfectant for household articles? It has been already covered. I think most
white
of
and yellow fungus, because they are just the color. They're basically a fungus, and a fungus is an opportunistic infection. It doesn't affect an immunocompetent person. If you're immunocompromised, that is particularly for adults, diabetes, malignancies, all those things, cancers and all that, that can cause you to suffer from it.
I think one point you both can stress about the pregnancy and COVID, or pregnant mothers, the last trimester, or any other precaution, something which is also important for the child also, if anything you want to cover.
Well, there are 2-3 aspects to this question regarding pregnancy and COVID.
Yeah.
If the mother contacts COVID when she is pregnant, usually nothing happens much, but the child may be prematurely born. That's one issue. Second issue comes with whether the pregnant lady should be given vaccine. Yes, premature delivery can occur. The pregnant lady should be given vaccine. Since we don't have data, we are not able to recommend it. But as of now, in the US and in Western Europe, it is being routinely recommended, because not that they did a trial, that they give pregnant ladies the vaccine and they found out, they inadvertently, without knowing that the lady was pregnant, they gave the vaccine to around 30,000 women. And then they found out there was no harm, absolutely fine.
Correct.
So that's why their associations and the authorities there have recommended that they should be given to pregnant women also. In India, as of now, we're still not recommending that way. But yes, it is quite safe as far as the evidence goes.
Well, another question has cropped up that I think we have dealt with it, but still, again, I think he must have joined late. This is a question of heavy flu.
Just don't need to buy that expensive medicine, which is very expensive. It doesn't really help you. It is an antiviral, and viremia is only for the first 5 to 7 days. And all viruses spontaneously passes out. Antiviral drugs are to kill the virus. I only want to mention one point here, the new thing that what President Donald Trump took. It's now available in our hospital in CMRI.
Yeah.
And that's a cost you not less than 60,000 rupees. The monoclonal antibody combination within day 5 can put you out of the trouble. It will not progress, but still these are only anecdotal. And that probably the monoclonal antibody, 2 drugs joined together.
This cocktail.
Cocktail, yes. And it is only a very small trial. If you want to give anything within first 5 days, that's the drug. And the damage for corona is due to inflammation, body immunity, hyperimmunity reaction. And antiviral drugs has no role at that point of time.
So I think I'd request Dr. Manglik to sum up,
please,
in 2 lines, and then we'll close the session.
One suggestion, get your vaccine if you're not yet vaccinated as soon as possible. Don't try to pick and choose. Get your vaccine, the first dose tomorrow itself.
Questions.
Absolutely. Second, despite having taken both doses of vaccines, don't lower your guard. So don't forget your mask. Third, avoid crowded places and ill-ventilated places. Avoid small air-conditioned rooms. Unfortunately, most of our offices, most of our banks are like that. But yes, we probably will have to go back to around 30 years ago when most of our banks were having no ACs. Most of our offices were not having ACs. So probably we'll have to revert back to those days again. We've got to change. I think these were the 3 things for which I would like to highlight.
And finally, I want to add one thing, the topic of the day, third wave. Don't get panicked about third wave.
Perfect, yeah.
If we can do a good vaccine with the grace of God, we will be as close to UK people that there will be no third wave. We are only having the chance of a third wave because we are not having enough vaccine coverage. But even if there is third wave, there is no guarantee that what is in times of India, that the children will suffer most. I still do not know that why the third wave been propagated in the media, and I can only finish with Professor Jacob John's webinar day before yesterday from Trishul. He said, "Pehle second wave to complete karo, don't dream about third wave." And it's not that the children will be affected by third wave. So let us hope for the best.
Prepare for the worst.
Yeah, I think there are 2 more questions we have just come in. We'll just, in 1 minute, we'll just take it. It is already covered also. Can a seafood allergy person get vaccination?
I think yes.
Yes. There is atopy is not a contraindication or
Never.
anything.
Our doctor died because he didn't took it. Okay.
And my father, 65, has recovered from COVID 1 month back. He is still taking vapor and gargle. Is it required anymore?
I don't think
COVID
so.
is concerned, not. But you can protect yourself from other ailments. I mean, it's a good hygienic practice. Fine, no harm in it. But don't expect that I will be taking it, I won't get a COVID again.
Yeah, perfect.
Remember, even if you get a COVID again, it will be very mild.
Yes. Thank you.
I think
the infections occur, but very mild. Yes, sir.
One of our doctors, I think Dr. Guha, you must be knowing, Debashish Guha, he told my wife that day that I have become, forsha hoye gechi vapor nite.
Good idea.
So I think I'd
Bravo,
like to
yeah.
thank once again on behalf of IndySmart and IIHM, Dr. Ghosh and Dr. Manglik for the excellent deliberation. I think it has been very helpful to all the non-medical persons. And I think it is one of its kind. I think this type of webinar we have been having, we are always having medical webinars. So now I'd hand over the mic to Abdullah to end the session.
Thank you so much, everybody, for joining in. Ladies and gentlemen, COVID-19 is a topic which can go on for the next 3 hours as well. And 1.5 hours is too less. Unfortunately, time is short and we will not be able to carry on. But I guess it was a very informative session. Thank you so much to all our doctors, Dr. Arun Kumar Manglik, Dr. Gautam Ghosh, Dr. Shubhankar Home, and we had Dr. Arbin live joining in all the way from London. Thank you to all 4 of you. Ladies and gentlemen, on behalf of Dr. Bose, who's the chairman and CEO of EduGuy and IndySmart Digital, IndySmart Group, I would like to say thank you to everybody for joining in, to all the listeners for posting questions. It was indeed a very, very good session. We've already posted the chat link of this particular session onto the chat box. So all of you can copy that, because this information you will not get anywhere in any journal or in any newspaper anywhere. So if you wish to go back and see and share, please go ahead and do that. With this, I come to the end of the session. You were watching this special episode this evening on how students and parents can beat the third corona wave, and all the answers, all the questions have been answered. Thank you so very much for joining in. Enjoy your Sunday. Have a great day. And thank you for joining in this very, very, very special episode. Thank you and namaskar. God bless you. All the best.
All the best. Good night.